Hi everyone, welcome to Chapter 2. So what I'm going to do is provide you just with a very brief overview of the chapter and really try to key you into things to think about as you're reading and going through the PowerPoint. So just remember how pivotal leadership actually is in the success of an organization. And that means not only the leader's success, but really looking at employee satisfaction. And ultimately, what we're there for is actually for those outcomes for patient care. Think about satisfied employees providing care to patients and the outcomes and the satisfaction of patients or clients. So just kind of keep that as the underpinning. Think about why we do what we do. So as you're reading your chapters, really focus on the leader's role in employee engagement. Think about your upcoming assignment when you're going to actually identify a need for education within your area of practice. So really think about how education is an investment in employees. And not only that, but education can provide direction, align people together, provide motivation and inspiration, because you're really investing in the employees and showing them that they're very valuable in not an unauthentic way, but it's really to enrich their ability to practice and actually practice to their capability. And that's what leadership is all about, empowering employees. So just kind of consider how everything fits together and how departments need to be aligned as well, and looking at how we can engage those that we work with to work toward those overall or overarching goals of an organization. So key words to think about as you're reading are inspiration, motivation, and direction. So those are three key factors to think about. Consider also micro, meso, and macro interactions, and make sure that when you're thinking about those interactions at the different levels, from very intricate interactions on a daily basis to big picture interactions, that you're sending the same message. And many times employees get mixed messages dependent on the different levels of focus. So just kind of keep that in mind as well. Think about the intricate balance in management and leadership. And they're two different things, but they work hand in hand for positive progression within the organization. And keep in mind that leadership is a lived experience. It's what you do, it's who you are, and ultimately being authentic is the key. And because of that, that's how one develops trust. We need to be very authentic with the folks that we work with and develop that trust and those very valuable relationships that will help you in your leadership practice as well. And always, always, always remember that each and every interaction is an opportunity to learn and reflect. And we use reflection within some of your coursework, and that's very deliberate, because leaders really need to be reflective and think about what happens and really take a step back and analyze what could have been done differently, what went really well, how did the situation make one feel, how did one apply those management or leadership principles in that situation. Was there some kind of way to address the issue in a different way that may have been a little more beneficial for that particular situation. So with that being said, one must be very deliberate in their leadership practice. So leaders can really create and destroy cultures. So it's been kind of a well-known statement that people actually leave leaders. They don't necessarily leave organizations. So that's a real important factor to think about as you're practicing and really do some heavy-duty reflection on that particular premise. So with that, also think about emotional intelligence and really knowing yourself and having those valuable people who are mentors and guides to you, who can help you kind of reflect on the situation or maybe give you feedback that you can't really see yourself. And that's very helpful as you progress in your leadership practice, as well as having those really strong, honest folks working with you and mentoring to help you to build as you grow as a leader. And there isn't such a thing as getting to that destination, because one is always practicing and refining skills as you go, no matter how long you've been a leader. So really take a look at, getting back to the textbook, the 8 archetypes of leadership in Chapter 2. Think about your personality type that we did during the first discussion board and kind of correlate those with the archetypes that you see within your book. And looking at transformational leadership and the chaos and complexity that occurs in healthcare, just change is. That's just the way it is. So that really necessitates us to integrate transformational leadership among our leadership skills. So take a look at those 4 key competencies as well on pages 34 and 35. Pay attention to focusing on trust, meaning, being attentive, and really self-management. So those are 3 key factors to think about as well. So I want to focus in on a very important statement that's within your book as well. Leadership is not an exercise of power. It's the empowerment of others. And very often we see things the flip side, or other people may perceive leadership as the flip side, as really being in power. And in actuality, you are empowering others to achieve beyond what they may expect, and to actually elevate their practice, and thus then elevate your practice as well as a leader. So back to chaos and complexity, really focus in on innovation. And change is often very linear, and we really need to adapt. So we need to think more in terms of innovation rather than systematic focus and things that take very long periods of time to change, because we really need to be adaptive in healthcare. And sometimes our processes that we undergo as we're doing some change is very long and drawn out, and sometimes isn't exactly what we need to do when we're in this chaotic, ever-changing environment. So, I apologize, I had to get a drink. Just to finalize everything in Chapter 2, really know that leadership transcends one particular style, and leadership may incorporate many different capabilities or capacities for different types of leadership, and one needs to be very specific as far as knowing that different types of leadership works in different situations. So also looking forward, look ahead at not only the here and now in leadership practice, but also in looking at refining strategic leadership and thinking about leadership amongst your peers. Really take a look at the Newtonian characteristics that we experience pretty much right now, and some are getting to the New Age imperatives that are on page 42, but really we're still a little bit on the hierarchy type structure. So think about what you're seeing in your practice and kind of compare and contrast what you're seeing with the Newtonian characteristics on page 40, and also compare with the New Age imperatives that you see on page 42. So when looking big picture, just remember that there's those very strong underpinnings for effective leaders, and mixing and matching between leadership and management is a critical key and balance. So just know that there still needs to be some degree of structure and management, but leadership, looking forward, empowering others, serving as mentors is such a valuable tool as you're helping your folks to elevate what they're doing and achieve those greater outcomes that we're all looking for our patients and those that we serve. So if you have any questions, let me know. I'll look forward to our discussions about the case study, and just know that we are going to do some interaction as far as questions on the readings, that you'll be able to pose a question to your fellow classmates to trigger some conversation on areas that you have very definite interest in as well. So take care now, and I hope you have a good module. Thank you. Bye-bye.